Welcome to this fast-paced, high-impact journey through the world of adrenergic agonists, powerful drugs that stimulate the sympathetic nervous system and play a crucial role in medical treatment. Let's dive deep into their pharmacology, mechanism, and clinical applications. The autonomic nervous system is divided into two branches, the sympathetic and parasympathetic systems. Adrenergic agonists mimic the sympathetic nervous system, often called the fight-or-flight system. These drugs bind to adrenergic receptors and trigger physiological responses like increased heart rate, bronchodilation, and vasoconstriction. Adrenergic receptors are classified into alpha and beta receptors, each with distinct functions. Alpha-1 receptors cause vasoconstriction, increasing blood pressure and dilating pupils. Alpha-2 receptors work in the central nervous system to reduce sympathetic output, helping lower blood pressure. Beta-1 receptors, found in the heart, increase heart rate and contractility, while beta-2 receptors promote bronchodilation and vasodilation, making them essential for asthma treatment. Beta-3 receptors play a role in lipolysis and energy metabolism. Based on their mechanism of action, adrenergic agonists are classified as direct, indirect, or mixed-acting. Direct-acting agonists include epinephrine, which stimulates all adrenergic receptors and is crucial for treating anaphylaxis and cardiac arrest. Norepinephrine primarily activates alpha-1 and beta-1 receptors, making it effective for hypotension and shock. Phenylephrine, a selective alpha-1 agonist, is widely used as a nasal decongestant and vasopressor. Dobutamine, a selective beta-1 agonist, is used to treat heart failure, while albuterol, a selective beta-2 agonist, relieves bronchospasms in asthma and COPD. Indirect-acting adrenergic agonists enhance the release or inhibit the reuptake of norepinephrine. Amphetamines increase norepinephrine release, leading to enhanced CNS stimulation, while cocaine blocks norepinephrine reuptake, amplifying sympathetic effects. Mixed-acting adrenergic agonists like ephedrine both directly activate receptors and promote norepinephrine release, making them useful in treating hypotension. Adrenergic agonists are life-saving in several critical conditions. Epinephrine is the gold standard for anaphylaxis, rapidly reversing bronchoconstriction and vasodilation. In cardiac arrest, epinephrine and norepinephrine stimulate the heart, restoring circulation. Beta-2 agonists like albuterol are frontline medications for asthma, providing rapid bronchodilation. In cases of hypotension and shock, drugs like phenylephrine, ephedrine, and norepinephrine help maintain blood pressure. Additionally, amphetamines like Adderall are prescribed for ADHD, improving focus by enhancing dopamine and norepinephrine activity. The human body runs on two opposing forces, the sympathetic and parasympathetic nervous systems. The parasympathetic system, often called the rest and digest system, slows down bodily processes to maintain homeostasis. But when danger or stress arises, the sympathetic nervous system takes over, launching the fight-or-flight response. Adrenergic agonists mimic this system, activating adrenergic receptors to trigger physiological changes like increased heart rate, bronchodilation, pupil dilation, and vasoconstriction. But how do these receptors work? Adrenergic receptors are specialized proteins on the surface of cells that respond to catecholamines, natural neurotransmitters like epinephrine, adrenaline, and norepinephrine, noradrenaline. These receptors are divided into two major types, alpha symbol receptors and beta symbol receptors, each with distinct functions. Alpha-1 receptors, located on blood vessels, they cause vasoconstriction, increasing blood pressure and dilating pupils. Drugs targeting alpha-1 receptors are commonly used for hypotension and nasal congestion. Alpha-2 receptors, found in the central nervous system, they work differently, reducing sympathetic output, which lowers blood pressure. These are used in hypertension management. Beta-1 receptors, primarily located in the heart, stimulating them leads to increased heart rate and cardiac contractility, crucial for managing heart failure and cardiac arrest. Beta-2 receptors, found in the lungs and skeletal muscles, they induce bronchodilation and vasodilation, a key target for treating asthma and COPD. Beta-3 receptors, less commonly discussed but important, they regulate lipolysis and energy metabolism, making them potential targets for obesity treatments. Adrenergic agonists are classified based on their mechanism of action into three major categories: direct-acting, indirect-acting, and mixed-acting agonists. Direct-acting adrenergic agonists, these drugs bind directly to adrenergic receptors and activate them. Epinephrine, adrenaline, a powerhouse that stimulates all adrenergic receptors, alpha-1, alpha-2, beta-1, and beta-2, making it the go-to drug for anaphylaxis and cardiac arrest. Norepinephrine, noradrenaline, primarily works on alpha-1 and beta-1 receptors, making it a critical agent for treating hypotension and shock. Phenylephrine, a selective alpha-1 agonist, commonly used as a nasal decongestant and for treating hypotension. Dobutamine, a beta-1 selective agonist, frequently used to improve cardiac output in heart failure patients. Albuterol, salbutamol, a well-known beta-2 agonist that provides rapid bronchodilation, making it indispensable for treating asthma and COPD. Indirect-acting adrenergic agonists, these drugs do not directly bind to receptors but increase the levels of norepinephrine in the synaptic cleft. Amphetamines, e.g., Adderall, these enhance norepinephrine release, boosting alertness and focus, commonly prescribed for ADHD. Cocaine blocks norepinephrine reuptake, intensifying sympathetic effects, leading to increased heart rate, alertness, and euphoria. Mixed-acting adrenergic agonists, these drugs directly activate receptors while also increasing norepinephrine release. Ephedrine, used in hypotension and nasal congestion, it provides both direct receptor activation and indirect enhancement of norepinephrine release. Scene transition, clinical applications of adrenergic agonists. Adrenergic agonists save lives in countless medical emergencies and chronic conditions. Let's see them in action. Anaphylaxis, epinephrine is the first-line treatment, rapidly reversing airway swelling and hypotension. Cardiac arrest, epinephrine and norepinephrine restore circulation by stimulating beta-1 receptors in the heart. Asthma and COPD, beta-2 agonists like albuterol relax airway muscles, providing immediate relief from bronchospasms. Hypotension and shock, phenylephrine, norepinephrine, and ephedrine work to increase blood pressure and improve perfusion. ADHD, amphetamines like Adderall improve cognitive function by enhancing dopamine and norepinephrine activity in the brain. But these drugs come with significant risks. Overstimulation of the sympathetic system can cause tachycardia, fast heart rate, hypertension, high blood pressure, arrhythmias, irregular heartbeats, insomnia, anxiety, and nervousness. Caution is advised in patients with hypertension, heart disease, and hyperthyroidism. Most adrenergic agonists are metabolized in the liver by enzymes like COMT, catechol-O-methyltransferase, and MAO, monoamine oxidase, and excreted by the kidneys. Epinephrine has a short half-life, requiring frequent dosing in emergencies. Advancements in biotechnology and AI-driven drug discovery are paving the way for next-generation adrenergic agonists. Researchers are focusing on more selective beta-3 agonists for obesity management, long-acting bronchodilators for better asthma control, AI-designed adrenergic drugs with fewer side effects and improved precision. Scene transition, conclusion with animated wrap-up of key points. Adrenergic agonists play a vital role in emergency medicine, cardiology, pulmonology, and neurology. Their ability to modulate the sympathetic nervous system makes them powerful tools in modern healthcare. As research advances, we anticipate even safer, more targeted therapies to improve patient care. If you enjoyed this video, hit like and subscribe for more cutting-edge pharmacology content. Stay curious, stay informed, and we'll see you in the next video.